So let us continue. So let us continue Nash therapeutics study streak, and the last remedy that we discussed was graphitis. And Dr. Nash goes further in the same book, Leaders in Homeopathic Therapeutics, by describing similar remedies one after the other. So glad to see Dr. Wasi B, Dr. Aru Mansuri, and a few people on YouTube as well. Uh, this is Nash Therapeutic Study Streak, and we are doing all the remedies from Leaders in Homeopathic Therapeutics by Dr. Nash, and we are taking it up like Dr. Nash has written in his book, one after the other in relation to the other, comparing, differentiating one remedy from the other, some clinical tips, some philosophical, inspirational messages, some potency related, you know, tips that Dr. Nash gives. So let us continue with today's Nash therapeutic study streak, and the remedy that we'll take up is sorinum, which comes after graphitis, which is the last remedy that we took. So what does Dr. Nash say about sorinum? Now we have to understand at what time this remedy was written in his Materia Medica, in his book, Leaders in Homeopathic Therapeutics. What time it was written, and it was a time when it was around 1890s or 1900s, when no swords were being explored. So it is obvious that we will find very less data related to no sword from Dr. Nash. There are many other books, or there are many other people who are doing good research on no sword, so we will find more relevant data for sorinum. Although Dr. Nash also writes around 5 pages, and we will see how he differentiates few remedies from sorinum, and how sorinum has to be selected, or what cases he saw were of prime importance. So, no swords, he says, are the disease products, powerful remedies which can come out of no swords, and they have made wonderful cures, and they were widely proclaimed by Dr. Swan, whom he quotes very often. And Dr. Nash tells us that gonorrheal, syphilitic, or soric troubles have been cured by no swords. Now, in today's age and today's era, if we compare this, we will see that there will be troubles which are deep seated, there will be troubles which are pathological, there will be troubles which relate to destructions. They are often syphilitic. There will be troubles which are superficial, functional related, they may be soric, or they may be related to some soric remedy or a polycrest remedy. So we have to think it in today's age, and what the author has written way back in 1900s or 1800s, or whatever age we see that book as. For sorinum, Dr. Nash tells us that eruptions on the skin, sorinum is indicated. For rheumatic troubles, medorinum is indicated. And for caries of the spine, cephalinum is indicated. And he gives just one line each for these three no swords, but they are invaluable because they give us insight into how we can use this remedy for all the patients in the long run, whether it can be a follow-up, it can be intercurrent remedy, or it can be, as a constitutional treatment per se, which is currently the scenario. Way back then they used to only give it for as an intercurrent medicine. Nowadays we are giving it as a constitutional medicine also. So scenarios will keep changing, but we have to adapt to something that is also helping the patients, and also helping homeopathy per se. So he tells just one line each for Sorinum, and then he goes and tells us that each nosode is capable of producing similar symptoms when given by mouth, improving as when given by inoculation. And he explains why is inoculation or vaccination is not considered a part of proving. It is well worth a consideration, and he puts some questions for the reader to understand. It is for us to explore, or maybe the next 100, 200, 300 years, something may come up, but maybe that part is left to explore, and he puts questions for us. So he says that all nosodes are capable of curing as they are capable of poisoning as well. And he says that Sorinum, as a proving in all the provers, was found to be curative in skin diseases per se. So specifically, skin diseases were helped in all the provings, or symptoms of skin were mostly produced by Sorinum. Now he tells us that this remedy Sorinum is kind of a complementary to sulfur in many ways. And many cases where we will find sulfur to be prescribed, we will see that it is also a recipe for Sorinum, although there is a just a fine differentiation, and he gives us very beautifully for us to understand, like he gives in all the other remedies, how one remedy needs to be differentiated. This is what we should learn from Dr. Nash. So he tells us that itching when the body becomes warm, sorinum is there, sulfur is there. Itching intolerable in the warmth of bed, itching scratches till it bleeds, itching between the fingers and the bends of the joints, dry scaly eruptions which disappear in summers and return in winters, and repeated outbreaks of eruptions. So each of these sentences carry a lot of weight. If you are on this Instagram live, you will understand, and if you watch this recording later on, you will understand how each of these lines are important. And if you go and read it again and again and again, these same lines, sometimes we don't understand the meaning of certain sentences by the author in one reading. Just read it again, just read it thrice, four times, and it is sure to make an impact on your mind. And the point what he emphasizes is that there are repeated outbreaks of eruption. So outbreak, what is an outbreak? It is a episode of eruption which stays for certain period of time. It can be seasonal, it can be something that is like an epidemic, or something that is individualistic also. So if that episode keeps coming in a patient, and if he gives you a history of those type of eruptions, then it is a perfect recipe for prescribing Sorinum. And the last nail in the coffin Dr. Nash puts for Sorinum is that the skin has a dirty, dingy look, as if the patient has never washed the skin. It kind of smells so bad. Body has a filthy smell even after a bath. Apart from this, Dr. Nash tells us that consequences of suppressed eruptions, you should 110% think of Sorinum, and should never be forgotten when all the other antisorics have failed. So we have remedies like causticum, we have remedies like sulfur and pulsatilla and Sorinum, which we should think of in cases where we have given antisorics and we have got no result, or we are stuck up. He gives us a very beautiful case of Dr. Hawley of New York, where there was dropsy in a case of old woman, and this was a case of long standing. It can be 5, 10, 20 years, the duration is not mentioned. And just by the appearance of the skin, the filthy looking skin or the old looking skin, Dr. Hawley prescribed Sorinum 42 m potency dry on the tongue, and the case was cured in a short time. Now imagine a homeopath who is giving only on the basis of appearance of the skin. Nowadays we are all getting lost in lot of delusions, lot of interpretations, lot of mental rubrics. And we have in Dr. Nash's book a case for Sorinum which has been cured by just the appearance of the skin and the highest potency that was available at that time, 42 m single dose. This is an eye opener for all of us who are getting lost in lot of uh, rubrics and interpretations and uh, ifs and buts and lot of confusions. Go to the source books. You will find the right way to prescribe what remedy you wish to prescribe. Next is Dr. Nash gives us the comparison between graphitis and sorinum, and he tells us that graphitis and sorinum are very much closely, but sorinum is depressed in the mind, and there is great despondency, or it's a sadness. Despondency is nothing but sadness, where he makes his own life and those about him intolerable. And he also gives us what disease condition he has seen these states, and it is after acute diseases or typhus. So there will be people who will be very much nagging, irritable after a bout of acute illness. Give them a dose of sorinum, things will be set apart. If you go to some books, you will find rubrics where there is weakness after acute diseases. Boger synoptic key generalities, weakness after acute diseases. There are only three remedies. Sorinum is one of them. So if you remember your literature very well, you can connect materia medica and repertory and pharmacy and potency and posology and philosophy, everything together, and bring out the best for your prescription. So, going further, Dr. Nash tells you that graphitis and sorinum stools are dark brown, watery, offensive odor, but in graphitis there is moisture from the eruptions and there is glutinous or sticky discharge, whereas in sorinum there is not such a case. Last but not the least, he comes to the end of explanation for Sorinum, where there is he again emphasizes that all the weakness that anyone has from recovering from an acute disease. You see, in Boric there is a mention that there are repeated convalescences. Patient gets well, gets ill again and again in the recovery period only. The remedy is Calcarea Cup. But if there is weakness after a short bout of acute illness or recovering from the illness, you will see that there is sorinum which should be indicated. And the indications you will find in the smell, the filthy odor, and the sweating, which you will find from least exercise. So he goes further to describe the comparison between China and Sorinum also. And China is loss of fluids and blood suppurations, whereas Sorinum has all of the above, plus the history of tendency of eruptions, which you will get confirmed. So many times in acute cases, we don't know whether to give this remedy or that remedy. We have to look back at the history of the patient, or if you don't have the history, we can ask the patient what was the past few illnesses that you suffered. Was it skin? Was it gastric? Was it head related? Whatever it is. And if he gives you the details, you have the remedy Sorinum to prescribe with active, you know, points. Next, Dr. Nash gives us that sorinum is good where you have all the excretions, whether it is diarrhea, leukorrhea, menstrual flow, perspiration, all have a filthy smell, and it also has sensitiveness to cold air or change of weather. So hepar sulfur, all is also another remedy. All the patients who come to us with recurring tendencies of cold catching, you should think of sorinum, you should think of tuberculinum, and you can think of hepar sulf as an intercurrent to give them after 15-20 days or 1 month, one dose each, and it will kind of settle them for a good cover up for the upcoming season. Next, Dr. Nash tells us that the Sorinum patient wants to wear a fur cap or overcoat or shawl even in the hottest weather. And there are chronic complaints which are traced, there is a history of imperfectly cured or suppressed acute diseases. So many times in acute cases, we don't take the past history of the patient, or in chronic cases, we miss out what is there in the past history of the patient. In such cases, we can ask such patients, and if it is located to imperfectly cured, sometimes patient will tell you that we took treatment, skin treatment for 1 2 months from a dermatologist, and then again the problem started. That's an imperfectly cured case. Or the skin trouble was driven away by some antibiotics or by some anti fungal medicines or steroids, suppressed acute diseases, suppressed conditions. Think of Sorinum to start the case, or give intermittent doses of Sorinum in between, and the case will be perfectly fine after 2 to 3 months. Don't expect an immediate result, but after a few months you will get the result. And next comes something which is very beautiful, and Dr. Nash gives compliment and tells the reader to buy a copy of Allen's keynotes, which has a very good rendering of the nosodes, in fact, all the nosodes. So that's all from today's session on Sorinum, and we'll take up a couple of remedies tomorrow evening again on this Instagram page, Humyo Setu WhatsApp channel. If you're following Instagram, Facebook, YouTube, you are going to get your homeopathic practice transformed. So stay tuned with something interesting coming from me and my team.